Willow Creek Springs presents Healthy Living with your host, Joe Grumbine.
Hello and welcome to the Healthy Living Podcast. I'm Joe Grumbine, your host, and today we have a new guest, a special guest, and his name is Dr. David Clarke. And Dr. Clarke is president of the Association for the Treatment of Neuroplastic Symptoms. And it's a 501c3 nonprofit dedicated to ending the chronic pain epidemic, which I think we might find interesting here. He holds an MD from the University of Connecticut School of Medicine, board certified in internal medicine and gastroenterology. His organization's mission is to advance the awareness, diagnosis, and treatment of stress-related and brain-generated medical conditions. And he's got a website called symptomatic.me. And I'd like to welcome Dr. Clarke. Welcome to the show. How are you doing today?
Just great, thanks. Good to be with you, Joe.
Fantastic. Well, I'm glad that we connected. And, we got a lot of big words that we just threw out here. So let's jump into this. This is a healthy living conversation. And we have people from all across the walks of the medical profession to every kind of patient with every kind of problem looking for answers. And pain is such a ubiquitous element in most people's lives, and all the different ways people go about resolving pain. I'd say that there's always a place in our conversation for this topic. So, first of all, what are neuroplastic symptoms, and how do these differ from something caused by injury or disease?
Yeah, that's a great place to start because my training as a clinician, first 4 years in medical school and then the next 3 years of a hospital residency, it was all about organs and structures. The belief was, the training was that if you've got pain or illness, there's got to be a diseased organ or a damaged structure to explain it. But it turns out there's a whole other category, and I found out about this in year 8 of my formal training, when I encountered a patient that I didn't know the first thing about diagnosing or treating. And she was quite severely afflicted. I was a gastroenterology training program at that time, and she was referred to us from UC San Diego. Actually, I was at UCLA. Because she was averaging one bowel movement per month, despite
Yikes.
taking 4 different laxatives at double the usual doses.
Ooh.
And we did, some follow-up, very specialized testing on her because all her other tests had been normal. Even our specialized test was normal. But it turned out that this patient's symptoms were coming from the brain. The brain was generating these symptoms, and
Wow.
the brain can generate chronic pain. It can generate a whole long list of non-pain symptoms throughout the body, even in the absence of any organ disease or structural abnormality. And this affects 1 in 5 adults and 2 in 5 people who go to the doctor. They come in, they've got real live symptoms. These are not in people's heads. These are absolutely real. They get the diagnostic tests. No definite explanation shows up. And the doctors typically don't know where to go next. And where we go is we look for psychosocial stresses, issues in the person's life that are stressful for them, that if it's severe enough and it's going on long enough, can end up changing the neuroanatomy of the brain, the nerve structure of the brain, and result in physical symptoms in the body. All of this sounds terrible, but the good news is that it's just as treatable, at least as treatable as any other form of illness. And that patient with the terrible constipation had complete success, complete relief of her symptoms with less than 3 months of the new kind of specialized counseling that's available now for this condition. Which, at the time, I didn't know how to do that. I found a psychiatrist at UCLA that was knowledgeable in this. And I was shocked to find out that she had cured this patient. I did not think it was possible.
Wow.
But she taught me the framework. I've used it in my practice ever since. Over 7,000 patients in the last 40 years or so. And it absolutely works. And we've now got randomized controlled trials, the highest standard of scientific clinical trial from across North America. Halifax, Harvard, Detroit, Boulder, Colorado, UCLA, that are confirming that this approach works vastly better than approaches that have been tried in the past. And people can get relief. It's remarkable. Just like that first patient that I thought, no way she's ever going to improve. And 3 months later, her problem was completely solved. So tremendous amount of hope for this, but we have to incorporate into our thinking that yes, the brain can do this to the body.
So a lot of questions come up for me, in my experience. I've been, I'm not a healthcare professional. I just play one on the podcast. But what I do is I share my own personal experiences with people, and I formulate natural products, and I share the experiences I have about those with my guests. And I bring in other professionals that have different experiences. And some of the things that you're describing are kind of like what growing up you hear as like psychosomatic, you're not really sick. It's all in your head. Or even something like what came to mind was like phantom pain that amputees find themselves in. They had a leg, now they don't have a leg. Their foot hurts them. They don't have a foot, but it hurts them, and they
Yeah,
feel
it's
that pain.
generated in the brain.
Yeah.
Absolutely.
So you would say that what I'm describing fits the model of the types of pain that you're working on.
Yeah, it's the same process that produces phantom limb pain, pain in the foot that isn't there. The brain can produce pain and lots of other symptoms anywhere in the body from head to toe if there's, enough stress going on. And one of the challenges is that a lot of times people don't fully recognize the degree of stress that they're experiencing. That very first patient that I mentioned, she was 37 years old. She had suffered sexual abuse as a girl. It stopped happening 25 years in the past, but it was still in there. That trauma was still getting processed, and it ultimately reached a point where the stress level from that trauma was so high that it manifested in her body. But by identifying that, by bringing it into conscious awareness, by getting her therapy for that, the symptoms went away. And it's not always in 3 months. Sometimes it can even be faster. Other times people need some number of years of psychotherapy to achieve the same outcome. But everybody can be put on a pathway toward steady, gradual progress in their healing. And that's what we're trying to get for everybody who's suffering from this condition.
Now, I've noticed, and again, it may be perception, maybe my awareness of things has changed as I've gotten older, but it seems that there's been a huge rise in autoimmune diseases. Everything from lupus to Epstein-Barr, diabetes, even related things that it seems that there are these problems that maybe we've always had, but we've recognized now today, we've identified as being caused by our own body sort of attacking itself. And in connection with that, I've also, there's been this giant rise of cancers. And it almost seems like these are all following sort of this law that your own body can build and it can destroy as well. Like, cancer is your own body cells that have gone through enough stress that they're like, screw you, I'm going to go do something else. And it seems almost like, what you're describing. I can't think of the term of the disease that became fairly popular about 10, 15 years ago, where people get nerve pain and like phantom sort of pains and burning and
Yeah, maybe complex regional pain syndrome or a functional neurologic disorder,
yeah, there was a catchphrase for it a while ago, but anyways,
repetitive strain.
a lot of people were going through it, and they're like, no, this is real. I feel like I've got these little strings coming out of my skin. I've got, burning sensations. And then they're like, there's nothing wrong with you. Like, we've done every test in the book and there's nothing wrong with you. So it seems like a lot of these things that you're talking about, I've noticed when I was a kid. My dad was a surgeon when he was alive, and so I spent a lot of time sort of in the medical world, surrounded by physicians of all sorts and all of that. And it just seemed like the terms that we heard and the things that were talked about, there's been this big shift, it seems. And again, it may just be awareness and our ability to test for things, but it just seems like maybe it's environmental. Maybe we live in a more stressful world, but it just seems like there are so many more diseases or symptoms or problems that seem to be caused by some kind of trauma or stress.
Yeah, I think a lot of these have been around for years, but we're only just now figuring out where they're coming from. It used to be the thinking that if you had one of these brain to body conditions, that you couldn't handle your own stress, that the symptoms were imaginary in your head, as you mentioned, that you really couldn't diagnose it, that you were just going to have to live with it. And it turns out none of those things is true. If you know what to look for, you can absolutely diagnose what's going on. And what we look for is stress in your life at the moment. One of my patients, the only time he got his symptoms was when he was driving to work.
Ah.
When he was driving home from work, he was fine, so didn't have to be
How'd you
too
get a new
smart.
job?
Yeah, I talked to him about what was going on in his workplace, and it was pretty bad. So, but it helped him a lot just to see that connection, and he could go back and talk to his supervisor about, making some changes. So that helped him a huge amount. A whole lot of people had stress when they were children, what we call adverse childhood experiences, which essentially amount to anything you would never want for a child of your own. And it can be, out and out sexual abuse or physical abuse or, uh, violent drug abusing alcoholic in the home, those kinds of things that are very obvious. But it also can be far less obvious, where kids were put under pressure to perform, for example, or made to feel like they were second-rate human beings. And that can have significant long-term impacts on people as well. They can become perfectionists. They can focus too heavily on the needs of others in their world and neglect themselves, which becomes stressful. They can be highly self-critical. They can feel like they're an imposter when they're given a promotion. Lots of different sources of stress for people coming out of their childhood years. And then it can be a mental health condition.
Right.
People can be suffering from depression and anxiety disorder, or they've been through a trauma. One of my patients, her parents were killed in a motor vehicle accident, and her husband almost died as well in the same accident. She herself was not in the car, but it was traumatic enough for her that she developed symptoms almost immediately afterwards that persisted for the next 5 years, and nobody knew why
Wow.
until I found out that right before those symptoms began, this terrible trauma had occurred in her life, and we were able to get her uh, treated for post-traumatic stress disorder, and her physical symptoms went away after that. So lots of different sources of stress that are capable of causing these symptoms. And it's not just pain. Some of my patients have had dizziness or even pseudo seizures or trouble swallowing or visual disturbances or fatigue is one, bladder spasms, all kinds of gastrointestinal symptoms like diarrhea or constipation or nausea or vomiting, certain kinds of rashes, joint stiffness. Pain in the low back actually is a huge one. Recent study found that almost 90% of pain in the spine was due to this neuroplastic condition. Actually, if it comes to mind, if people are curious about this and they have some symptoms themselves that are not responding to medical care the way their doctor expects, we've got a wonderful 12-item self-assessment quiz on the website symptomatic.me.
Cool.
It takes less than 3 minutes and can give you a lot of insight. Each question comes with a little bit of explanation that gives people insight into whether any of this might be applying to them.
Wow, that sounds fantastic. I wonder, the generation that we come from, we were probably raised a little harsher than subsequent generations. And now we live in a world where, timeouts and everybody's equal and good and nobody gets in trouble for anything anymore. I can't help but wondering, obviously there's going to be some blowback from the last few generations, the way they were raised, as we're seeing. But I wonder if there's going to be a difference in the amount of this kind of traumatic, um, symptomatic issues. What do you think?
Well, I think we're already seeing it. We've seen a higher level, especially in younger people, higher levels of stress, depression, anxiety, suicidal thoughts. The isolation that is going on around people's devices, communicating with each other via a device rather than face to face.
Right.
Even text messages replacing phone calls.
That's huge. I think that's
All
huge.
all of this isolation is having its effect on people, and the way a criticism of somebody in school, for example, can go viral amongst your peers, and
Right.
all of a sudden a rumor becomes believed by everybody you know. And we didn't have to deal with that when we were growing up, you
Oh
and I,
no.
but the
Took
kids
months for a
today,
rumor to get around school. Today, it's like in 3 seconds, all of a sudden
yeah,
everybody's in their head at you. Yeah.
yeah. Yeah, you walk into school and all of a sudden people are looking at you different than they did the day before. It's really a tough burden. And it's having an effect on, as I say, people's isolation and on their mental health and their general stress levels. And that's on top of, very well-intentioned parents who want the best for their kids, want their kids to succeed, and who will constantly be noticing when their kid is falling short in one way or
Right.
another and be pointing out to them the ways that they need to improve. And you can overdo that very easily. Parents, and I've seen this in many of my adolescent patients, can crank up the pressure level to excruciating levels
Right.
without even knowing that they're doing it. And kids, eventually their bodies protest.
100%. You said that it wasn't until your 8th year of medical training that you sort of came to an awareness of this. And I speak with a number of doctors about a variety of subjects, and it seems that medical training has some gaps in it for various different reasons. And I just kind of wonder on this one. I mean, there's so much research and money spent on psych drugs and mental health um, treatment and resources. It seems like this might fall into a category where that would be important, but clearly, if it didn't come up until the sort of end of your training, I wonder, what do you think that's the gap in our mental health system that or doesn't even recognize this the way it should?
Yeah, it is a huge blind spot in the system. The mental health professionals don't get training so they feel comfortable with people who are physically ill. If you don't typically go to a mental health professional about your abdominal pain or your back pain, for example, and the mental health professionals are not comfortable dealing with those symptoms. Similarly, the medical professionals, once they've figured out you don't have an organ disease or structural damage, they're not really familiar with where to go next and doing an assessment for a person's stress in the past or in the present. And so these patients that have this kind of a blended situation where it's a mental health stress affecting a physical body reaction, they're stuck in a blind spot in the system. And many of them kind of wander around looking for answers for years, sometimes for decades. My personal longest duration of illness patient had this condition for 79 years.
Whoa.
And she was a nurse, so she was very well plugged into the system, and still could not get answers. It all stemmed from a trauma that happened to her when she was 8 years old. And
Wow.
it was still affecting her at age 87. So again, these are 100% real, and it shows you how long of an impact they can have. But we're starting to see that change now in response to the randomized trials that are getting published in top journals. I mean, the Boulder back pain study, for example, was published in JAMA Psychiatry, Journal of the American Medical Association Psychiatry Journal. So very well known, got CBS Evening News coverage, got Washington Post coverage, very well accepted research. And with that being out there, it triggered funding for even more studies, which are underway at the moment. And
Right.
we're starting to be able to get into professional training schools. I taught at two different graduate schools for psychologists. I'm teaching at the medical school in my community in Portland, Oregon. I've been teaching the physician assistants in my community since 1997. And there are a couple of medical schools in Europe that are using my first book, which is
Right.
called They Can't Find Anything Wrong, as a textbook.
I'm wondering, do you think that like in medical training, you have psychiatry that is in the medical side of things, and then you have psychology, which sort of breaks from that a little bit. You might be a PhD, but you're not a medical doctor as a psychologist typically. And so I can't help but wonder, like when you think of psychiatrist, generally you're dealing with, physiological problems that get solved generally with drugs and sometimes with other treatments, but generally with drugs. And that's typically what a psychiatrist is going to do. You might sit there and talk to him so he can evaluate, what this problem is, but typically the solution is, going to be some pharmaceutical or electro, whatever, there's going to be some physiological issue. Then you get with psychologists, and it's really kind of a wide open, field because you don't have the same FDA sort of oversight with a psychologist as you do, and you're dealing with different types of practices. I can't help but wonder, do you think there's going to be some kind of a hybrid study that or type of um, practice that comes out of this?
Well, a lot of mental health professionals are learning how to provide this kind of care. On the symptomatic.me website, we've got lots of training resources, recorded conferences. We had a live conference last year, late September in Boulder, Colorado. We're having another one in Boulder in late September in 2025. And we're teaching people how to do this. A mental health professional, whether they're a psychologist or have a master's degree, they can take this information about how we diagnose and treat these patients and graft it onto what they're already doing relatively easily because they've already got the knowledge base that they need and the techniques that they need. And we just give them a little extra on top of that so that they can feel comfortable with people who've got migraines or abdominal pain or whatever it is. And they can have a lot of success with this. And once people learn how to do this, they love it. I mean, there was a family doctor that took our training on the East Coast, and I met her at a conference, and she took me aside and said, "These ideas have put the joy back into my work."
Wonderful. It
So,
sounds very promising, and it sounds like, the way I look at things is, you've got a risk versus reward, and you say to yourself, okay, well, if I don't do this, you know, this we have sort of a preordained path that you're going to go down, or nothing will change. And if you do this, well, what's the likely good could come of it? What's the likely harm could come of it? And unless somebody's really being, malevolent with hypnotherapy or something like that, it seems like these practices can only do good, and it'd be pretty hard to cause harm. It
oh
really
yeah. They
this
not only alleviate symptoms, but they help people make changes in their lives that are very positive as well. It goes right along with that. Their relationships with people change, their ability to take care of themselves and make time for their own joy improves. Lots of positive benefits that are even over and above the benefits to the physical symptoms.
It almost sounds like I've interviewed a few osteopaths, and it seems kind of a long line of that sort of medical training where they follow along with, traditional allopathic training, but then they reach out into some of the other not so accepted practices, and sort of cross over both ways. Would you think that that would make sense?
Yeah, well, that's what I want to see happen for every healthcare professional's training is to take these ideas and just incorporate them. It's what I did. I mean, whenever I had a patient whose diagnostic tests, and two-thirds of my patients, they had an organ disease or a structural damage of some kind. But if they didn't, then I would start asking them, what's going on in your life right now? What kinds of adversity did you experience as a child? And then I would try to make sure that I wasn't missing a more subtle case of depression or anxiety. I would ask about, have you been through terrifying or horrifying trauma in your life? Did that happen right before your symptoms began? Or sometimes the trauma happened a long time before the symptoms started, but there was some kind of trigger that happened that did start off their physical response, their physical symptoms. So all of these things can become and should become a normal part of the training of healthcare professionals. And it turns a group of patients, a large group, almost double the size of the number of diabetics in this country. 50 million in the United States have this.
Wow.
And it takes that group of patients from being one that frustrates the heck out of medical clinicians, and they become very rewarding to work with because they get better.
Right. Exactly, 100%. I could see a lot of good coming out of this. I work with a lot of people using natural therapies, and frankly, who knows? Maybe it's a placebo effect that causes all the amazing changes I've seen. But so be it. I've always said, give me a bottle of placebo any day. If it makes me better, I don't really care. And I believe that there's some logic to this, and I think that I think a common sense approach to medicine is what's required. I really think that you're a good match for this show for that reason. I've tried to get people to think outside of just what their primary care physician tells them. Maybe they're telling them the right thing, but you're the patient. It's your job to get in there and find your own problem. And I really think that this is some really good work. I
Thank you. Yeah, we try to, we believe in placebos. We know they work. There's solid evidence that they work, but this approach has been compared with placebos, and it's way better. And
Fantastic.
all kinds of different placebos. Some of them were cognitive behavioral therapy. Another one was a mindfulness-based stress reduction. Another one was a big injection into the spine.
Wow.
All of these things have been compared with the pain relief psychology that I'm talking about. And the pain relief psychology is miles ahead. For example, in the Harvard study, 64% of people got complete relief of pain from this approach. In the mindfulness-based stress reduction control group, only 24%. As one of my colleagues put it, if it was a football game, the score would have been 64-24.
I am we're pretty much out of time, but I gotta wonder, do you feel any fear of any blowback from the pharma companies? Because it sounds like the things that you're offering aren't going to require people to take pills and shots and drugs and maybe get better anyways. What do you think?
Yeah, I think the pharmaceutical companies are not going to have their products needed as much when this approach is used. I think the same is true of invasive forms of pain treatment, like spine surgery, for example. The success rate of surgery on the spine when it's just for pain, not for nerve damage, but just for pain, is
Right.
about 25%, which is just appallingly bad. The approach, that for this, the pain relief psychology, 64% complete relief in that one study. In the Boulder back pain study, 75% improvement in the pain scores in 1 month on a
Wow.
group of people who had had back pain for a decade on average. I mean, this is miles better than spine surgery. So yeah, those forms of treatment are going to suffer. The cost of providing medical care to people with this condition is going to go way down. I mean,
Right.
just imagine that woman with the pain for 79 years if she had been successfully treated when she was 10 years old instead of 87.
Unbelievable. Well, Dr. Clarke, it's been a pleasure. I really look forward to learning more about what you're doing. I hope that it really takes off. Is my experience in the medical world is that it's got a lot of room for improvement. And, as we're learning more, getting more capable, some things just get left behind the wayside. And I'm glad we got pioneers like you out there picking it up and putting it out there for everybody to see. So I appreciate you being here, and hopefully we'll have you back on again soon.
All right. Thank you so much, Joe. Symptomatic.me for those who are interested.
Fantastic. I'm going to explore that myself. All right, Dr. Clarke, you have a good afternoon, and we will talk soon. Thank you for everybody for joining us here on the Healthy Living Podcast. This has been another episode of the Healthy Living Podcast. We produce this show so that people can share their stories, people that have overcome obstacles, people that are undergoing obstacles. We're building a community of health-minded individuals. If you're interested in supporting the show, please leave a review on the platform you're listening to it on. If you're interested in becoming a guest, please send an email to itsjoegrumbine@gmail.com, or you can send a note into the notes section of the podcast. All right, well, thank you for supporting this show, and we hope you've enjoyed it.